And social distancing, the most key thing is that individuals who are sick, particularly with fever, flu-like symptoms, or cough, should avoid public places, and that includes work, school, church. Individuals who are at high risk, so that would be our seniors or individuals with chronic illnesses, should reevaluate their schedules and determine all the ways in which they can be socially distant. So an example may be avoiding a large church service and doing church service by online or some other way, or maybe going to a smaller church service. If you need to go to the grocery store, going when it's less crowded rather than when it's most crowded. But avoiding public places as much as possible. Also encouraging those who are hosting events, including conferences or meetings, to look at ways in which those can be postponed or canceled so that we can reduce transmission. Also, you know that Shelby County Schools has added an extra week to spring break. So I encourage families to use that time to engage in social distancing, to stay home, stay close with the children, but not necessarily be out at big gatherings and not necessarily traveling to locations that have cases. The Centers for Disease Control website is the website with the most accurate information on nationwide cases and international cases. So people should look at that before they make decisions to travel. The Tennessee Department of Health every day at 2 o'clock identifies where there are cases across the state so that people can make travel decisions across the state of Tennessee. And then I will reinforce the need for hand washing. Frequent hand washing with soap and water or alcohol-based hand disinfectant according to the instructions. And then I'll end with what I started with. People who are sick need to avoid public places. That is very difficult to do, but that is the most important thing that's going to prevent the spread of COVID-19 in our community. So again, if someone's running a fever, they have flu-like symptoms or a cough, they should remain at home and avoid public places. If they're sick enough to need medical attention, we encourage people to call their healthcare provider ahead of time and make arrangements so that they prevent the spread of COVID to others who may be in the waiting room or to the healthcare provider. And if they need emergency care, if they call 911 to notify the dispatch that they're having symptoms of COVID-19, to protect our first responders who come to the scene and to protect the emergency room. So I'm going to end there and open it up for a few questions.
To make sure, I know you can't give out a lot of information, but it's two people who were in New Orleans.
Yes.
And they know each other, obviously.
Yes.
So the second person apparently now has COVID-19. So can the first person who apparently got it first get it again?
At this point, the evidence doesn't support that. But keep in mind that this is still a new virus and a lot of things are being learned. And so at the current time, there's not a belief based on the science and the evidence that people will get it again. But we also have to make sure that the person who was index case or number one remains isolated until they're completely recovered.
And did both of the people remain isolated when the first one found out?
So when the index case was isolated before they were diagnosed. When we received that notice, if you remember last week, we announced that we quarantined everybody who was a contact. So this particular individual was under quarantine from the time that we knew that they were a contact. Yes, sir, I'm sorry. Okay.
What's the relation? You said they knew one another, the two individuals. Are they family members, friends?
Friends.
Friends.
They travel together, yes.
Gotcha.
And were they attending some type of meeting? Do we know, as far as the investigation, how the spread actually happened, how they contracted in New Orleans?
So that's a great question, because given nationwide, there have been cases linked to conferences. My understanding is they traveled for Mardi Gras.
So what the belief is that essentially they both got it while celebrating Mardi Gras.
Or one got it and gave it to the other. I noted earlier they stayed in close contact upon return. So one could have given it to the other. And again, we're gathering more information.
Can you say anything about the test kits? Some doctors are saying that there are only 77 kits available, and you have to go to the health department to get a kit, and the health department determines if you can get one, if you're a doctor. Right?
So there's still a lot of questions around testing, and what I want to share is for individuals who have needed tested in the state of Tennessee, we have been able to secure testing. Because this is a new virus, the test was a new test, and it has to be determined to be both valid and reliable first. Then the laboratory that runs the test has to be approved as having run valid and reliable tests. So the first laboratory was the Centers for Disease Control Laboratory in Atlanta. Subsequent to that, state laboratories received permission to run the test. And that's what we currently have in the state of Tennessee. Our state laboratory runs the test. While we're a county health department that's independent, we have tried to cut out the layer. So it doesn't mean that a provider has to call our health department first and we call the state. They call the state directly and the state keeps us in the loop. There is criteria to determine who should be tested. And that's the criteria that's adhered to, and that'll change as more information comes available. Once the specimen's approved, it'll be collected and either flown to Nashville or driven to Nashville for testing. If the test arrives in the evening, it'll be run the following morning with results by 1 o'clock. And they are running tests 7 days a week. What is happening now, which will be the third wave, is private laboratories are attempting to get permission to run the test within their laboratories. My understanding is LabCorp is able to run tests, but I don't know if they are actually running them currently. And then Quest and AEL are seeking permission to run tests in the state. So I anticipate in the coming weeks, there will be more opportunity to do testing locally, but the criteria would still be expected to be adhered to.
How many people have been tested in Shelby County at this point?
I don't have the number, and the reason I don't have that is that we know what gets sent to the state lab, but if anything was sent to LabCorp, we don't know that, or if it was run in a hospital lab, we don't know that. And the Veterans Administration has their own system, so we can't account for all tests at this point, although I think we'll start being able to release what we have requested be tested.
When do you think that would start?
We probably could do that as early as tomorrow or over the weekend.
Has the Shelby County Health Department been in contact with the Office of Veterans Affairs regarding the person at the Memphis VA who has been monitored for coronavirus?
So, the VA, we have individuals who are being monitored, and some of those could be veterans. There have been some specific, very detailed rumors around Veterans Administration, but I don't have any information that confirms that.
Do you have any update on the first case as far as how that individual is doing? I know it's been a few days.
And that person is recovering and doing quite well, and that's important because if people get diagnosed early and get adequate treatment, then they have as much opportunity as possible to recover and do well and return back to their daily activities.
Are you able to tell us how old they are, what range?
No. I've told before they're adults and they're over 40. So I think that's sufficient.
How severe are the symptoms for the second individual at this time?
So the second individual at this time is not hospitalized, but they did exhibit the classic symptoms and signs, which is why the testing was ordered.
So if you go to the doctor and the doctor makes the contact for the determination on whether you should have the test, he looks at you and says, okay, you've got this, and this, but you don't have these things, so you don't have COVID-19. Is that the way that works?
So when you go to visit a healthcare provider, the first thing they're going to look at is your overall history, and that includes your travel history. So if you said you went to Seattle recently, or Boston recently, or DC recently, that would be critical. And then they'll look at your signs and symptoms. They're encouraged to also test for flu A, flu B, and do an overall viral panel. Then if those come back negative, to test for COVID. Some healthcare providers want to be able to do all of it at one time. It really just allows them to get the diagnosis more quickly, and that's why getting commercial labs up is going to be important, so they can run those all at one time. The other piece is there's much more information as this disease is spreading on the radiological findings, and so chest x-rays can also help the healthcare provider make some decisions.
It sounds like, and I know you don't know everything.
And you've been listening to some very